Senator Kane.
Thank you, Mr. Chair. Dr. Monarez, it was good to visit in the office about public health data modernization, a priority we share. Your written testimony interested me because when a witness prepares testimony and chooses to bold 2 lines, that tells me that these are the really important lines in the testimony. And the 2 lines that you bolded in your testimony were, good public health saves lives, and when public health is neglected, it costs lives. Those are the 2 bolded lines. Is smoking a public health issue?
It is.
And is ignoring smoking as a public health issue run risk to people's lives?
Smoking prevention and mitigation is a very important public health strategy to mitigate the risk associated with tobacco use and cancer.
Thank you for that. Mr. Chair, I'd like to introduce in the record an article from Stat News from April 14, quote, why CDC cuts are being called the greatest gift to tobacco industry in the last half century.
Without objection.
The article points out that on April 1st, the CDC's Office on Smoking and Health was eliminated. There were 120 full-time employees. They were all laid off. Contractors into the office had been all laid off in February. If smoking is a public health issue and ignoring it is a public health challenge that could risk lives, how can we justify the complete elimination of the CDC Office on Smoking and Health?
As you know, I was not by law involved in any of the personnel decision making.
Can I actually don't know that. So let's focus on that. You were at the CDC from January till March 24th.
Mm-hmm.
All of the and you were the deputy director and then acting director.
Mm-hmm.
All of the contractors who do work with this really important office that have been around for decades were all laid off in February when you were in that position. And the employees were all laid off on April 1. So let me just ask you, did you have anything to do with the decisions about eliminating all the contractors and then all the employees in the Office on Smoking and Health?
I am not aware of the layoffs to the contractors.
Okay, but now let me just, did you, so the answer is you did not have anything to do with the layoffs to the contractors, if you're not aware.
I am not aware.
Did you have anything to do with the layoff of all the employees of the office?
I had no participation in the personnel decision-making after I left.
Right, but so you were not involved in any discussions about laying off the entire office before you left on March 24th?
So I'll tell you what I was involved in. So we were given clear guidance from the secretary.
But I only want to know about the Office on Smoking and Health, so don't talk to me about anything else. Were you involved in any discussions about laying off the entire staff of the Office of Smoking and Health before you left on March 24th?
So when we were given the tasking to return CDC to its core functions related to preventing, detecting, and responding to infectious diseases and emerging threats, I worked with the career staff there to make sure that we did both made sure that we were reinforcing those core mission areas. And
in those discussions, did the Office on Smoking and Health, was that office discussed?
I don't recall that specific office, but
okay, well, if you don't recall the specific office, then I'm going to go to a next question. Just, you're a career public health professional. I mean, if public health saves lives, and this is an office that's been going for decades that's shown real effectiveness in reducing smoking, isn't it a bad idea to completely shutter the Office on Smoking and Health and lay off all the employees and contractors?
Look, these issues are still public health priorities. And
For who?
they're public health priorities for the secretary, they're public health.
Okay, public health priorities for the secretary. The article that I introduced in the record also points out that he's laid off almost all the smoking expertise at the FDA. So give me any evidence that this is a public health priority for the secretary.
So this is a public health priority for the secretary.
Tell me one thing he's done. You have laid off the entire office at the CDC.
So
all of the contractors, all of the employees. You've gutted the FDA. Let me read really quickly. The end of OSH comes along dramatic changes at the FDA, including the elimination of the center's management and regulation divisions and the ouster of top tobacco regulator Brian Kling and head scientist Matthew fairly. You didn't have anything to do with the FDA, you're not there, but give me one thing that this secretary has done that would suggest he understands what you testified to, that smoking's a public health issue.
So the secretary has continued to support preventing chronic disease.
Okay, is smoking-related disease a chronic disease?
Cancer related to tobacco use can turn into a chronic
Yeah,
disease.
because it's what Senator Ousted said, the things we put in our bodies, that's a chronic disease. It would seem like that would be something that would be a priority for the HHS secretary, and yet the CDC, complete elimination of this office, and the FDA, dramatic curtailment of its office. I really have questions about, not about the statement that you made in your testimony, nor about your qualifications. I've got questions about your willingness to follow through on your values. I yield.
Mr. Chairman, I'd be happy to yield to Senator Collins if she'd like to go. Are you sure? Okay. Absolutely. Doctor, it's good to see you again. I enjoyed our conversation yesterday. Let me just ask you about the massive increase that we have seen in recent years when it comes to children and what we're seeing with chronic diseases, autoimmune diseases, developmental disabilities. This is something that Secretary Kennedy has talked extensively about. I know that you share his concerns on this. What can CDC do to help reverse the spread of these kind of chronic conditions in our country?
Yeah, this is a very important issue to me, and it's a very important issue to the secretary as well. I think, you know, as CDC refocuses its efforts specifically on communicable diseases to prevent, detect, and respond to infectious diseases and emerging threats, we'll be laser focused on that area. But I think we will continue, and I will continue to make sure that we're supporting the secretary's vision on overall making America healthier again, making sure that we're supporting his initiatives to improve food sources for our children, making sure that we're supporting efforts to allow our children to enjoy physical activity, making sure that we're supporting clean water that is available to them, to really reduce all of these conditions that are leading to exactly what you just talked about, chronic diseases in our children, which ultimately, you know, is a public health threat that we just cannot continue to promulgate in this country.
We have seen in Missouri, we've seen a significant increase in chronic health diseases in children, particularly in the St. Louis and St. Charles areas. That's on the eastern side of my state. One of the reasons for this is the presence of nuclear radiation and nuclear toxins in our soil, in our air, and in our water. Are you familiar with the Westlake Landfill Superfund site in Bridgeton, Missouri? Do you know what I'm talking about?
I'm not familiar, but this is something that, again, these are very important issues to me, and I'm happy to work with you if I'm confirmed as CDC.
This Superfund site dates back to the Manhattan-era uranium enrichment project. St. Louis was a uranium enrichment site during the Manhattan Project, of which we're very proud. But after the uranium enrichment was shut down, the federal government did not dispose of the nuclear waste. What they did instead is they dumped it into a public landfill. They allowed it to sit out in barrels that were exposed to the elements for years. So it was dumped into a landfill from which it ran into the groundwater. It sat out in barrels in another site for years, from which it then seeped into a nearby stream where there's now suburbs built. They started building in the 1950s. People have lived there ever since. And if you look at a heat map for childhood diseases linked to nuclear toxins, to breast cancer rates and other forms of cancer, particularly in women, we have some of the highest rates in the nation right there, right around this area. And I'm asking you because, as CDC director, you've got jurisdiction over the Agency for Toxic Substances and Disease Registry. Back in 2015, this agency did a health study on this landfill, on the Bridgeton landfill, on the nuclear radiation that was in St. Louis, and what the ATSDR concluded was that there was not significant pollution, that there was no health risk. I want to quote this: no health risk to the surrounding community. Now, since that time, we have learned that, in fact, the ATSDR report relied on faulty data. It relied on faulty methods, and there have been multiple subsequent reports, including those done by the government and the Army Corps of Engineers, that have showed that there is, in fact, extensive contamination. And as we speak right now, the Army Corps of Engineers is moving people out of their homes in the St. Louis area, those who live adjacent to this creek where the toxins are. They're moving them out of their homes because of existing, continuing nuclear radiation in their homes, in their yards. We've had schools that have been closed because of the presence of nuclear toxins in the air, in the dust, in the soil. Here's my question to you. Will you work to ensure that ATSDR, if you're confirmed, that ATSDR reviews its methodology and does another thorough study that corrects its faulty methodology from the past and gets the facts to the people of Missouri that we deserve on this issue?
If I'm confirmed as a CDC director, we will definitely look into this, and I'm happy to follow up with you.
Good. I'll just point out that it's so significant, it's so bad, ATSDR study, that the Reuters news agency did an entire report that we will make sure that you see, detailing the faulty data and, frankly, haphazard process that ATSDR used to issue this report that has been relied on, I might add, by corporate bad actors and other polluters to say, oh, see, there's nothing wrong, even as other agencies of the government are telling people, no, you have to leave your home because you've been exposed to nuclear radiation. We absolutely have to get this fixed and have to get it cleaned up. I look forward to working with you on that. I'll have other questions for you for the record. Thanks again for being here. Thank you, Mr. Chairman.
Senator Also Brooks.
Thank you so much, Mr. Chair. Good morning, Dr. Monarez, and thank you so much for being here this morning. I have to tell you, we have over the last 6 months watched this administration in horror, watched it dismantle our public health and research system, all while touting what they have called, quote, their effort to restore gold standard science. And I don't know what focus group came up with that title. It's untruthful. Because the fact is, cutting $12 billion from NIH research for critical cures is not gold standard science. Looking to cut $18 billion more will not deliver for us gold standard science, and firing 2,400 scientists and public health workers from the CDC will not make Americans safer from the threats of outbreaking and emerging diseases. Firing experts they have fired that provide recommendations for vaccines and sowing doubt about the science behind vaccines, I believe will lead to more Americans dying. Shutting down rural hospitals, throwing them off their insurance. I mean, it's just one thing after the next, which I think will not only make us sicker, but also cause us to die. This past week, you expressed confidence in Secretary Kennedy's new picks for the Advisory Committee on Immunization Practices, known as ACIP, saying that they were all credentialed scientists and medical doctors. And that same day, the committee's own chairman called for the delay of the committee's Wednesday meeting, saying that the new appointees, quote, do not have significant experience studying microbiology, epidemiology, or immunology. And so my first question for you is whether you believe that the 17 members that this administration fired from the Advisory Committee on Immunization Practices, in fact, lacked qualifications.
So look, part of the Secretary's vision in restoring public trust is making sure that the American people can be confident in the way that the evidence and science are driving decision making. The Secretary made a decision that resetting the ACIP from the 17 previous members to a new cohort of members was going to be on the path of restoring that public trust.
So I respect that you're not able to say yes, that they are qualified individuals. So I'm going to ask you just another question about it. Do you believe that the 17 individuals who the Secretary, bless his heart, appointed, have conflicts of interest that undermine their independence?
The 8 members that he appointed.
The 17, yep. Do you believe that they had conflicts of interest that undermine their independence?
You're talking about the previous 17.
The new.
The new.
Yes.
Okay. He's only appointed, I believe, 8, but now I understand that it's 7 members. To participate in the ACIP meeting, those members will have needed to go through an ethics approval process and declare conflict of interest. And the Office of Government Ethics will evaluate whether or not those conflicts of interest are directly related to the information that they're going to be receiving and evaluating as they conduct their business at the ACIP members. If the Office of Government Ethics makes the determination that the conflict of of interest are in fact directly related
And
to
Doctor, let me just ask you a specific question because I see the time tolling. Would you say that an ACIP member that made money as an expert witness, for example, in litigation against a major vaccine company would be considered a conflict of interest?
So that individual will have had to declare that during the vetting process by the Office of Government Ethics. And the Office of Government Ethics will make an evaluative judgment to determine whether or not that participation and that payment is directly in conflict with the ability of that ACIP members.
Let me just say this. So I know that it is not allowed, that generally these members are not allowed to serve as expert witnesses in vaccine litigation, yet Mr. Koldorf, who was appointed, he's a person who recently served as an expert witness for plaintiffs who accuse Merck of concealing the risks of an HPV vaccine. So that would be, I believe, a conflict. Let me just ask you something else really important. You're a scientist, and I know that you believe, I want to just ask you whether you believe that fluoride is safe and effective when used appropriately.
Fluoride is an important component to oral health, and there are various aspects of using fluoride to improve oral health. A direct application can be very valuable.
So let me just say this. So I'm so glad to hear that because the Secretary has directed the CDC to stop recommending fluoridation in communities. I'm very concerned about this. I know you are one of my constituents. I'm very happy about that. And your community has fluoridation. And so I just want to ask you a last question. Do you believe that the water in Potomac, Maryland, for example, is safe for families? They have fluoridation there. Is it safe for families, the water in Potomac, Maryland?
I believe the water in Potomac, Maryland is safe.
Thank you so much, Doctor.
Yeah, thank you, Chairman. Thank you for coming on out here today. I guess I just wanted to start by asking you, do you know what the World Trade Center Health Program is?
I do.
What is it?
It is it's a program that for individuals who were in the World Trade Center or in the vicinity that may have been exposed to chemical compounds in the cleanup and the aftermath, they have the ability to get screening and care as appropriate.
For those that were there, as well as the heroes that were at Ground Zero afterwards, we saw a 20% cut in their staff in February. I asked the Secretary about this. He said that he was unaware and did not realize that the funding cuts that he was making, that was authorizing, were cutting staff from programs such as this. I guess I just wanted to ask you, were you aware that programs like this would suffer, that this program would suffer from the staffing and budget cuts?
I was not involved in that decision-making, and I am not aware of what has happened.
So can you explain to me who was involved in that decision-making? So you were the acting director at that time in February. How did you have any input into the budget process?
I'm not aware of any of those staffing changes that transpired during that period of time or the budget processes. This is a critical, vital function that the CDC performs.
So in February, you showed up at work one day and they told you that, these are the cuts that are being made to your staff. Is that how it happened? Who told you that? Like, how did that unfold?
I'm not familiar with the specific details that you're talking about. I am happy to look into it and follow up with you.
So in February, when there were cuts to CDC staff, especially for the World Trade Center Health Program, do you recall how you were made aware of those cuts to the staff?
I am not aware of the specific details that you're asking about. I am happy to look into it and follow up with you if I am confirmed as a CDC director.
Yeah, look, I mean, I guess I raised this because, you said earlier that a lot of what you want to focus on is creating evidence-based, rapid decision-making. You want to make sure that your actions are being driven by the data, by the science. Yet, some of the most important decisions while you were acting director seems like they were made without your knowledge, without your inputs. Did you agree with those cuts to the World Trade Center Health Program?
The World Trade Center Health Program is very important to this country. It is very important that we continue to support it.
You did not agree with the cuts?
Again, I'm not aware of the specific details of what you're asking about. I'm happy to look into it and follow up with you.
Well, it was just a little odd because, they cut the staff. Congress, in many ways, bipartisan way, pushed back on this, and the staff were reinstated. I don't understand what the decision-making process is, and I guess that's something I wanted to get a sense of. What type of role would you play in terms of standing up against some of these cuts? If you disagree with them, what voice would you have? I guess I'll just switch gears a little bit here, just ask you, what do you think of Secretary Kennedy's performance and record so far since he has come in on secretary? How has he done in his job?
I think the secretary has laid out a very clear vision for making America healthier again. I think he has prioritized key public health activities for preventing chronic diseases, for reducing maternal morbidity and mortality. He has emphasized his support for the rural health areas, his support for Indian health services.
Is there anything that he has, is there a decision that he's made so far that you disagree with?
I think the secretary is doing the important work of leading a very complex agency through a number of different transitions. He is supporting key priorities in preventing chronic diseases.
Does anything come to mind, though, that you disagree with him on?
The secretary is doing the important work of leading a complex agency. He is supporting preventing chronic diseases.
There was a third of the staff was cut at the injury center, incredibly important part of the CDC. Do you agree with that staffing cut?
I have not been involved in the decision making.
Well, I understand that, but do you agree with it?
Look, the important work of public health is critical to all of the activities related to HHS. If I'm confirmed as the CDC director, I look forward to understanding what is happening within my own organization. I look forward to continuing to support these critical activities.
If you don't mind me asking maybe a slightly different way, do you know what the leading cause of death is for children in the United States?
There are a number of areas that we have to be concerned about for pediatric morbidity and mortality. If they're within the purview of CDC in terms of preventing and detecting.
And what are the leading causes of death for children?
The leading causes of death for children. Look, this is a complicated issue, and we want to make sure that we're covering.
It's just a numerical issue. I'm running out of time. Unintended injuries, homicides, and suicides under the purview of the injury center. And I would just ask you to keep that in mind if you're looking at further cuts.
Dr. Monarez, congratulations on your nomination. Francis Collins infamously emailed Anthony Fauci and told him to take down 3 prominent scientists. The implication was use whatever means, use the media, use reporters, but damage their reputations. One of these scientists is now the head of NIH, Jay Bhattacharya. Do you think that was an appropriate use of his office?
So I'm not familiar with that particular encounter, but we need to make sure that we are open to letting the science.
Is it an appropriate use of the office for Francis Collins to have emailed the head of NIH and say, take down scientists that he disagreed with?
We need to make sure that we are open.
It's sort of a yes or no question. Is it an appropriate use of office? Because the question goes to you. Is it an appropriate use of the office to email other government scientists and say, take them down? Take down these people that are disagreeing with us and have a different opinion?
It is not something I would do. I welcome an open and honest debate and scientific discourse.
Disappointed that we don't get a little better answer from that. You read OSTP 2015 to 2016. Was any of the research between Ralph Barrick and WIV, the Wuhan Institute of Virology, subject to the pause on gain of function during your period of time there?
I don't know the specific details of that, but all federally funded research that met the standards of gain of function should have been paused under that gain of function pause.
Right, but several were granted exemptions. Are you aware of an exemption that was granted to the Wuhan research?
I am not aware of that.
Do you believe that the research that was being done over that period of time and subsequently was gain of function research?
I haven't had an opportunity to look at that research, but I share your concerns about gain of function.
There's about 10 books written about it. I mean, we've been talking about it. 15 million people died. You're going to be in charge of infectious disease. You know, you'd think you might have an opinion on, you know, where this came from and what happened. And, you know, even EcoHealth, which was funding the research in Wuhan, finally sends a letter back to NIH, and they say, thank you for releasing the pause on our gain of function research. With regard to royalties, recently Secretary Kennedy fired members of the CDC vaccine committee. One of the things we've been asking for years is that they release their and reveal if they get royalties from pharma. I think this is a basic good government request. We've passed it unanimously in another Senate committee with Republican and Democrat support. Previous heads of the CDC and the Biden administration were adamantly opposed to revealing or any transparency. Will you support members, all members in decision-making processes revealing their royalties that they get from pharmaceutical companies?
I believe that anyone who is serving in this type of a role that is so critically important to make independent, conflict-free decisions needs to be fully transparent on any funding that they're getting from any product developer.
That's all I have.
Let's see, Senator Hassan.
Thank you, Mr. Chairman, and I want to thank you, Doctor, for being here today, and congratulations on your nomination. I'm going to start with a straightforward question that I ask every nominee. If directed by the President to take action that would break the law, would you follow the law or follow the President's directive?
The President would never ask me to break the law.
And if a President did, would you follow the law or follow the directive?
We'll always follow the law, and the President would never ask me to break the law.
Well, I'd ask you to review recent facts and perhaps reflect on that answer. Let me move to a second question. Doctor, the CDC supports critical local work in New Hampshire to fight addiction and overdoses, including funding that helps prevent addiction in youth, as well as a grant that helps New Hampshire track overdose deaths. Doctor, if you're confirmed, can you commit to continuing these life-saving programs at the CDC?
So CDC is moving towards getting back to its core mission of preventing, detecting, and responding to infectious diseases and emerging threats. If I am confirmed as a CDC director, I will look into and make sure that we have effective continuity of these key public health activities as they transition to other parts of the organization.
Well, I want to make sure that these services remain in place because they have been life-saving and critical not only to individuals, but to our communities and frankly to our economy in terms of workforce. So we will follow up with you on that. One critical role of the CDC director is to help protect children from lethal infectious diseases. The CDC director can't perform this critical role unless they are politically independent, which means that you must be willing to disagree with political leaders based on scientific evidence. So is there anything that you disagree with Secretary Kennedy about?
If I'm confirmed as CDC director, I look forward to having technical discussions with the secretary. He has said he values and prioritizes independent thinking and using science to drive decision-making. I am an independent thinker and I am a scientist, and I will welcome the opportunity to share my opinions based on science and evidence with him as he makes some of these very difficult decisions.
Is there anything you disagree with him about?
So look, if I'm confirmed as a CDC director, I look forward to supporting the secretary with science and evidence and making sure that I am giving him the best information possible to help support some of these critical decisions that
Well,
he's
let's go
making.
to some specifics then. When you were acting director of the CDC, Secretary Kennedy stated, quote, "It's very, very difficult for measles to kill a healthy person," close quote. Do you have any scientific concerns about Secretary Kennedy's statement?
So measles is an important public health threat, and we have to make sure that we are doing everything that we can to prevent and mitigate the
Do
spread.
you have any concerns about his statement? Didn't a child die from measles while you were acting CDC director?
See, measles can be lethal. We know from historical data that in populations, unvaccinated populations, that one in 1,000.
Right. So, excuse me for interrupting, but I have limited time. So when the secretary said it's very, very difficult for measles to kill a healthy person, no concerns from you about that?
So look, we know that measles can be fatal in 1 in 1,000 individuals. And look, these are very critical issues that we need to be able to
Right, which is
consider.
why you're being able to independently state in public that you differ with the secretary is a really, really important thing. And right now you're showing a real reluctance to do this. What about when Secretary Kennedy said, again, while you were CDC acting director, that cod liver oil and vitamin A have, quote, 87% effectiveness, close quote, for preventing death from measles. Do you agree with that from a scientific perspective?
So there are no FDA-approved antivirals or aligned treatments for the measles. We do know that vitamin A has been approved by the WHO and has been supported by the American Academy of Pediatrics as an effective supportive therapy to some.
And so where's the science that says it's 87% effective?
So I'm not familiar with that quote. I'm not familiar with the specific statistic, but if I am confirmed as a CDC director, I'm happy to look into it and follow up with you.
Well, for the record and with a request for unanimous consent, Mr. Chair, I have a copy of an article from the New York Times entitled, "I feel like I've been lied to when a measles outbreak hits home," from somebody who followed Secretary Kennedy's kind of alternative treatment theories in Texas, whose family got very, very, very ill, almost died because of measles. I am very concerned that a CDC nominee who says she wants to be independent and will apply science is so unwilling to speak publicly about scientific evidence that contradicts the Secretary. Thank you, Mr. Chair.